Hey future nurses, the cardiovascular system, it's the engine room of the body, and it's a big deal on the NCLEX. Why? Because it's crucial to, well, staying alive, and as nurses we need to know this stuff inside and out. We're talking heart anatomy, those tricky cardiac conditions, the life-saving nursing interventions, and how to prioritize like a pro. Trust me, mastering this information will not only help you rock the NCLEX, but also prepare you to care for your future patients with confidence. I'm Miriam, a nurse and nurse educator, and I'm here to break down everything you need to know about the cardiovascular system. In this video, get ready to deep dive into basic anatomy and physiology, those must-know cardiac conditions, key nursing interventions, and even those sometimes scary medications. We'll wrap it all up with some NCLEX-style practice questions and test-taking strategies. So grab your pens and your notes and let's get started. Alright, let's start with the basics, the heart. Think of it as a powerful pump tirelessly moving blood throughout your body 24/7. It's responsible for delivering oxygen-rich blood to your tissues and whisking away the deoxygenated blood. Understanding this flow, guys, is absolutely vital, especially when you're dealing with conditions like heart failure, murmurs, or those tricky valve disorders. Now, let's break down the heart's anatomy. It has 4 chambers, 2 atria on top and 2 ventricles below. Think of the atria as receiving chambers and the ventricles as the pumping chambers. The right side of the heart receives deoxygenated blood from the body and pumps it to the lungs to pick up oxygen. The left side receives this freshly oxygenated blood from the lungs and pumps it out to the rest of the body. Now, remember that handy NCLEX mnemonic I mentioned? Toilet paper, my arm. Let's break it down. Toilet represents the tricuspid valve separating the right atrium and ventricle. Paper stands for the pulmonic valve, controlling blood flow from the right ventricle to the pulmonary artery. My is for the mitral valve between the left atrium and ventricle. And finally, arm represents the aortic valve, regulating blood flow from the left ventricle to the aorta, the body's largest artery. Remember, blood flows from areas of high pressure to low pressure. When the heart muscle contracts, it creates pressure, forcing the blood through the chambers and out to the body. Disruptions in this pressure, like a narrowed valve or a weakened heart muscle, can lead to those cardiac conditions we'll talk about soon. Understanding this basic anatomy and the flow of blood is fundamental for comprehending how the cardiovascular system works and for interpreting those NCLEX questions that love to test your knowledge on this. So keep that flowchart in mind and repeat after me. Toilet paper, my arm, you got this. Okay, future nurses, let's dive into some common cardiovascular conditions that you're almost guaranteed to see on the NCLEX and more importantly in your nursing practice. First up is hypertension, also known as the silent killer. Why silent? Because it often has no symptoms but can lead to serious complications like heart attacks and strokes. As nurses, we need to be vigilant about monitoring blood pressure and educating patients on lifestyle modifications. Next, we have coronary artery disease, CAD. This one's all about plaque buildup in the coronary arteries, those vital vessels that supply blood to the heart muscle itself. When blood flow is restricted, chest pain, angina can occur, and if a blockage completely cuts off blood flow, it can lead to a myocardial infarction, MI, also known as a heart attack. Speaking of heart failure, it's not as scary as it sounds. It simply means the heart isn't pumping as efficiently as it should. We need to know the difference between left-sided and right-sided heart failure. Left-sided backs up fluid into the lungs, causing shortness of breath and crackles, while right-sided backs up fluid into the body, leading to swelling in the legs and abdomen. And finally, we have shock, a life-threatening condition where blood flow to the body's tissues is inadequate. There are different types of shock, each with its own set of causes and symptoms. Hypovolemic shock, for instance, is caused by severe blood or fluid loss, while cardiogenic shock results from the heart's inability to pump effectively. Understanding these common cardiovascular conditions, their causes, signs, and symptoms is paramount for effective nursing care. The NCLEX will test your ability to identify these conditions based on patient presentations, so study hard and be prepared to apply your knowledge. Chapter 3, Key Nursing Interventions, ECGs and Medications. Now that we've covered common cardiovascular conditions, let's talk about essential nursing interventions. One of the most valuable tools in our arsenal is the electrocardiogram, or ECG. This non-invasive test records the heart's electrical activity, helping us diagnose heart attacks, arrhythmias, and other cardiac issues. Knowing how to interpret basic ECG rhythms is crucial for the NCLEX. Pay close attention to the PQRST waves as they provide valuable information about the heart's electrical conduction. For instance, IST segment elevation could indicate a myocardial infarction requiring immediate intervention. Next up, medications. As nurses, we need to be well versed in the various medications used to treat cardiovascular conditions. Diuretics like furosemide, also known as Lasix, help remove excess fluid, reducing the workload on the heart. ACE inhibitors like lisinopril relax blood vessels, lowering blood pressure. Beta blockers like metoprolol or Lopressa slow the heart rate and reduce blood pressure. Remember, always prioritize patient safety when administering medications. Double check dosages, monitor for side effects, and be aware of potential drug interactions. For example, when administering diuretics, it's crucial to monitor potassium levels, as these medications can cause hypokalemia. Mastering these key nursing interventions, including ECG interpretation and medication administration, will equip you with the skills and knowledge needed to provide safe and effective care for your cardiovascular patients. Keep practicing, review those drug classes, and remember, confidence is key on the NCLEX. Chapter 4, NCLEX Practice. Test your knowledge. Alright, future nurses, it's time to put your knowledge to the test. Let's tackle some NCLEX-style practice questions that will help you apply what we've learned. Question 1. A patient with left-sided heart failure is most likely to experience which symptom? A. Peripheral edema. B. Jugular vein distension. C. Crackles and dyspnea. D. Hepatomegaly. The answer is C. Remember, left-sided heart failure causes fluid to back up into the lungs, leading to those telltale crackles and difficulty breathing. Question 2. A nurse is administering furosemide or Lasix to a patient with congestive heart failure. Which lab value should be closely monitored? A. Potassium, B. Sodium, C. Calcium, D. Magnesium. The answer is A. Lasix is a loop diuretic that can deplete potassium levels, potentially leading to hypokalemia. Question 3. A patient recovering from an MI is prescribed metoprolol or low pressor. What is the nurse's priority assessment? A. Heart rate and blood pressure, B. Respiratory rate, C. Temperature, D. Pain level. The answer is A. Metoprolol is a beta blocker that lowers heart rate and blood pressure. Always assess vital signs before administering. Remember, analyzing those NCLEX questions is key. Identify the topic, recall key concepts, and eliminate incorrect answers. Practice makes perfect, so keep those practice questions coming. Congratulations, future nurses. You've made it to the end of our cardiovascular system crash course. Remember, mastering the cardiovascular system is essential for NCLEX success, and more importantly, for providing exceptional patient care. As you prepare for your exam, keep these final tips in mind. Always prioritize your ABCs, airway, breathing, and circulation. Know the difference between left and right-sided heart failure like the back of your hand. For chest pain, assess first, then intervene. Monitor those potassium levels when giving diuretics or ACE inhibitors. And finally, learn those ECG strips, especially those lethal rhythms like VFib and VTAC that require immediate defibrillation. And hey, before you go, don't forget to download our free NCLEX study guide at nursecareerblueprint.com. It's packed with even more tips, tricks, and practice questions to help you ace that exam. You've got this. Now go out there and make me proud.